Jeannie and everybody at Asha, thanks so much for the invitation. We're really happy to be here today. There are lots of questions about COVID, as we would have expected. I've posted a number of comments back in the chat box, and I'll take those up a little later during the panel. So I'm going to talk about preparing and maintaining healthy schools for children. It's particularly important this fall because one of the big questions, and it's come up in the chat box, is how do you reopen a building that's been closed for 3 or 4 months, and then how do you keep it running? So while the conversation generally has always been about reopen schools, do it now, we're much more concerned about keeping them open long term, which means keeping everybody healthy for the long term. So I will share with you now how we think about the problem of schools and children, and it's a framework. And the framework begins that schools are not just little offices. And we mean that in terms of the physical environment. Schools are not just little offices. So just strike that from your thinking. The same way that children are not just little adults. And we mean that in terms of their biology, their vulnerability, their development. So let's talk about children a little bit. And this is well established in public health. And it's adopted policy through federal executive orders affecting CDC, affecting HHS, the U.S. Environmental Protection Agency, and all the agencies. Children are not just little adults. They are especially vulnerable to environmental health hazards because they're still developing. They eat and drink and breathe more per pound than adults do around them. They are often close to or on the floor or on the ground, so they have a different breathing zone. They often have hand-to-mouth behaviors. And for those of you who are familiar with children with in special education, you know that hand-to-mouth behaviors may persist into the teens and into early adulthood. Children also can't identify hazards or articulate exposures. And kids basically have a long shelf life. That is, early exposures and early injuries can result in a lifetime of health impairments. And I just want to say a word here about the virus and the pandemic. There is current development of some research around children and how they happen to catch the virus and where is it coming from. What we're looking for here is long-term studies, because what we're hearing from adults is long-term after effects from infections. Let's talk about schools. They're not just little offices. 95% of all the occupants in public schools are women and children. Both are vulnerable subsets of the general population. Schools are 4 times more densely occupied than offices. Schools often have multiple processes and chemical uses in one school facility, sharing one ventilation system, if in fact there's a ventilation system that works. Occupational Safety and Health Administration has specific rules to apply to all private employers, but the states must adopt a state OSHA plan and deliberately apply it to public schools as adult workplaces, and they have done that in only 24 states. Schools also have a very well-established and a record of poor facility management, meaning no consistent facility measures, inconsistent funding at a state level, virtually no funding at a federal level, very little oversight within the states, decades of deferred repairs and facility neglect. This comes from the Government Accountability Office, it comes from EPA, it comes from many other organizations. This is not new information. This is how we're moving into a pandemic year, is buildings that aren't ready. The poorest children have the schools in the worst condition. This is also well established because schools are often locally funded. The poorest communities very often can't come up with the dollars to do basic repairs or maintenance or do a renovation. So I want you to think about the pandemic now, which the poorest communities, Black, Latinx, Native American, have been hardest hit by the pandemic, and those are the poorest communities will send their children to the poorest schools in the worst condition. This is really a very profound, very troubling set of conditions. It's environmental injustice issue within the public health community, within the health care community, and now in the education community. It's really extraordinary. Let's look, pandemic or no pandemic, let's look generally at risk to children's health at school. And these are universal. I have used this slide for a long time. So indoor air, and I know Tracy Anger will talk more about this. Mold and moisture are problems because mold is clearly has human health effects. The presence of pests and the use of pesticides inside buildings. In fact, I think there are currently only 26 states, about half of states have some regulation around the use of pesticides in schools. According to our notes, only 23 of the states, slightly under half, have actually adopted best practices recommended by EPA on indoor air quality. It's a bad time to have that happen. Water quality is an issue. Noise, interrupting noise is a problem. Lead in paint and water is a problem. PCBs, polychlorinated biphenyls, they have an IQ effect similar to lead. Asthma and allergy triggers, asbestos, chemical use and storage, ventilation is clearly a problem. It was just resurfaced again in a new GAO report on school facilities, sanitation, and lighting. The issue is primarily one of deferred and neglected maintenance. And the neglect can actually have the effect of releasing legacy toxics. In other words, if you can't stabilize the lead paint, you will have more lead dust in the area. Renovation and expansion projects of occupied schools can also create problems. In other words, the school is fully loaded with women and children, and you have construction labor. Construction is a hazardous occupation. Construction labor on site, maybe with badges, perhaps not, you hope they do. Demolishing and rebuilding portions of the building. It's a very dangerous time for all occupants. A number of states have adopted formal protocols for isolating construction work from the actual construction labor that's taking place and the occupants. If you want more information about that, we can share that another time. Just to give you a visual, when you talk about school siting and how the site may impact a school, in the upper left is a picture, I think this might in fact be Houston, of a school, looks like a soccer field next to a chemical plant. So the issue there is fumes, danger of explosion, and perhaps even contamination of the groundwater. The upper right is a custodial closet, and if you ask your school custodian to open the closet door and you see something like this, it means you have a very dirty school. You cannot have a dirty custodial closet and have a clean school. The two just don't work together. The first thing you want to do is clean up the custodial closet and make sure they have current equipment and supplies. Lower left is out of an old urban school in the Northeast. It's exposing not only PCBs, but also lead and asbestos due to failure of the roof and mold development. A couple of things. One is it's great to see a sign about asbestos remediation taking place. That's a good sign. It means somebody knows what they're doing. What I would say is there's a problem with the chemical storage in the middle picture. This is not atypical. In fact, there are a number of states, but not all of them, that have tried to get a handle on old storehouses of old, outdated, mislabeled, and mischaracterized chemicals in schools. In the right is a problem, is meant to be a problem solver, but it's causing a problem. This is a damp wall, which is resulting in flaking lead paint. Latex paint rolls off a damp wall, but the lead paint, it sort of chips and flakes. So you have chipping, flaking, lead-based paint, damp wall underneath. One solution to create ventilation and perhaps dry out the wall is a floor fan. But what the floor fan is also doing, while it may be drying out the wall, is spreading lead dust throughout the classroom. Poor maintenance is exemplified by a couple of these pictures. The lower one is, it was a student protest movement in the Providence, Rhode Island State House. We need clean bathrooms and bathrooms that work. This is still an issue, not just in Rhode Island, but it's an issue everywhere. So when you're thinking about the pandemic and lavatories and ventilation and hand washing, you need to think about whether or not the lavatories actually work. On the right-hand side is a classroom which is in fact, we call it a hoarder classroom, but it's a public health hazard. There is no one who can get in and clean that. Beyond that, there's food storage, there are all kinds of supplies sitting out, and everything that's hanging off the walls and from the ceiling are dust catchers. It's a primary territory for asthma and breathing problems. So how do you clean up a school building, and why is it expensive to do? Well, this is a case where it's not very expensive. It simply means removing a lot of the debris out of that classroom and putting it someplace else, a garage sale or someplace else. This is also a good example why CDC and other entities these days should not be comparing American schools to European Union schools. European Union and the Scandinavian countries have a very different tradition, a very different culture about how they build school buildings, how they clean them, how they operate them, and they don't look like this. So take a look at those pictures when they come in through media about what a wonderful school looks like, and it won't look like this. The upper left, I want to explain a little bit. We're concerned about air quality in schools. One of the indicators of air quality is CO2, carbon dioxide, which is what we all exhale. And so if you have a lot of people in a classroom with a closed door and closed windows, the CO2 levels are going to go up. A normal classroom, what you would want for ideal teaching and learning is for those levels to hover under 1,000 parts per million CO2. And this is a CO2 meter, and this is a high school classroom, and the level is more than 4,000 parts per million CO2. What the science says about CO2 and learning and teaching is that adult executive thinking, critical thinking skills, being able to prioritize, being able to think clearly, being able to attend a task, adult critical thinking skills begin a steep decline at 1,000 parts per million CO2. And this is 4,000. So studies in American classrooms, and I won't speak to the EU on this topic, but in American classrooms typically run anywhere from 1,500 to 3,000 parts per million CO2. Not ideal. So we do a report, and I'll try to get through this quickly, state of the, on environmental health, state of the states. We look at all the states. The last time we looked at it, and things have not changed much, there were technically fewer schools than about 10 years ago. There were more children in public schools, more children with asthma, more children with special needs, more children in subsidized meal programs. That, of course, has escalated dramatically in the current year. Less federal and state money for schools, fewer staff, and more defined risks. This is not a picture for going into a pandemic year. A little bit of information about asthma triggers because it's directly related to air quality. I'm sure most people who are part of the school health movement and folks at CDC are well aware of how to remove asthma triggers from homes, but the same asthma triggers very often exist in schools. Pests exist in schools, mold, we hope not pets, chemical irritants, outdoor air pollution, dust mites, cleaning products, pesticide use, respiratory infections, and certainly fragrances and strong odors. So at the same time, people are worried about asthma triggers in the home and making sure children have a healthy home. You also have to make sure the school itself is healthy and not causing asthma. Let me move my slide here. I'm having trouble. There it goes. We also want to eliminate toxic products in schools. So that's whether or not you have old storehouses of chemicals which are going to contaminate the air or present really risks of explosion and other kinds of damages or anything else. So we have a national collaborative website. It was jointly designed by American Federation of Teachers, AFSCME, the National Education Association, a number of other organizations to promote the use of cleaner, greener, healthier products. Which is also a recommended step from EPA in terms of cleaning and maintenance, that you want, to the extent that you can do it, you want to use low odor, low toxicity products in indoor environments to have, which helps maintain good indoor air quality. So in terms of the pandemic and reopening schools, I want to say a couple of words about this. And repeating again, the communities that have been hardest hit by COVID are going to send their children to the schools in the worst condition. This is really a very profound problem. Regardless of all the wonderful guidance that any federal agency can write, we're really convinced that the states have a better handle on this in many ways, and using CDC guidance, the states actually need to create authoritative state public health plans for how to manage the school environment. It will help sort of make things more predictable. It's not necessarily up to every school how they run their buildings or run their occupancy rates. It really is a national issue that can be addressed by the states, because so many of the states have different sets of rules and regulations that affect how schools operate and how they're funding. So we think it's really important to have state public health involvement, and certainly at least local public health involvement. So the steps in reopening a facility, which I hope now that we're in the middle of July, most schools have already done something about getting a facility ready to reopen. And that has to do with routine inspections. Have they walked around the exterior or the interior of the building? Have they prioritized cleanups and repairs? If a building has been closed for an extended period of time, there may have been storm damage, there may have been flooding. If the ventilation system was shut off and it's been damp, you'll have a moldy building on the inside. Everybody needs a fire safety inspection before things start. So we have some recommendations about that in our new report called Pandemic v. Schools, online at healthyschools.org. It also contains recommendations about checking out the building systems, in other words, the drinking water system, the ventilation system. Are there new filters or fresh filters? Are they MERV 13 filters? Are there HEPA vacs in place? Check out the plumbing. Do the sinks work? Do the drinking fountains work? Do the toilets work? Do the electrical system work, the communications? And certainly in this era, it would be important while people are rearranging transportation and rearranging occupancy, review the emergency management plans that you have currently and make sure what you have is going to be adequate to the first month or two of reopening. And critically—
Thank you, Claire. We need to wrap up.
Okay, I'll finish up right away. So stock up on supplies. And that will be a supply chain issue in terms of masks and cleaning products. And then, of course, maintaining the facilities, scheduled cleaning and maintenance, safer pest control, and ventilation. So there are a number of selected resources here that we've made available, and a number of selected resources here that we will bring to your attention. Thank you so much.